I'm here today for two reasons. One is I'm one of the sponsors of this legislation, and the second is, whether many of you know it or not, I'm a cancer survivor. I was one of the lucky ones. I was diagnosed with a form of cancer that was relatively treatable, and I had access to some of the greatest doctors in the world to provide that treatment to me. That's the beauty of living in New Jersey. It's one of the beauties. You know, in any given time, you can be to some of the greatest hospitals in the world and back in the same day. And I can tell you firsthand that when you receive that diagnosis, the last thing you want to hear is your treatment or the medication or the procedure you need and that your doctor has prescribed is being delayed by an insurance company. You know, we've all heard of these stories. We've all received these phone calls. Just last week in my legislative office, I had two calls. One was the denial of a procedure, and the other was a denial of medication. A change in a medication that the insurance company felt did need to be changed, but the doctor was requiring. And if it wasn't for my office's intervention, those patients may not have received the care that their doctors prescribed. And there's something wrong with that, because the folks that called my office knew me. Think about all those people that are out there that don't know their legislator or are afraid to call and ask for help, or that don't know they can call and get that help. No insurance company should be subjecting their judgment for that of a doctor. And that's precisely what's happening. And unfortunately, we're seeing more and more of it. And I can tell you firsthand, again, I was at Memorial Sloan Kettering in New York just last month. And after my doctor came in and gave me the great news that I have another year of being cancer-free, I told him about this legislation. And he looked at me and he said, "I wish somebody had the guts to do this in New York City." He said, "Just so you know the process, Mr. Bucco," he said, "I have 2 full-time RNs that all they do is get pre-qualifications and approvals for treatment and medication that I prescribe to my patients." He said, "Yesterday, when I came into the office, one of those RNs met me at the door and told me that a procedure I had prescribed for a patient was denied by the insurance company." He said, "I knew the patient, and I knew the procedure, and I knew it had to be done. So I said to her, 'Please give me the number so I can call and talk to the insurance company.'" He called, he got an individual on the phone who began to tell him that the book in front of them and the guidelines that are established for the insurance company, that treatment really wasn't what was meant for this patient under those guidelines. The doctor took a deep breath. And then he told the person on the other end of the line, he said, "Sir, I wrote those guidelines that you're reading. I wrote those medical guidelines for treatment of patients that have cancer in this area. This shouldn't happen." When you're a parent of a patient with cancer, or you're the patient themselves, all you want to hear is that you can be treated and that the cancer is gone. And that's where we need to head. It's unfortunately we need to do this, but you know, the insurance companies sometimes make no bones about it. It's about costs. But the doctors are our doctors, and they're medical doctors for a reason. And nobody knows the patient better than their doctor. So So today, I'm going to sum up quick. I know you've been here a long time. But today, I think this is a discussion that we need to have. And I am sure that Leader Bramnick and the other members on this bill with me are open to discussion on how we can make sure that insurance companies are not subjecting their judgment for that of the people that are treating them.